This is a podcast from the Nuffield Department of Medicine. Today, Professor Eduard will tell us about his research on reducing HIV. Hi, Eduard. Can you tell us a little bit about your research and where you actually work? Because that's quite unusual as well.
All right. So, I've been working in coastal Kenya for the last 12 years, supported by the International AIDS Vaccine Initiative, to find people at a higher risk for HIV infection, as we like to test an HIV vaccine and, of course, contribute to developing that vaccine and testing its efficacy. We quite unexpectedly, we stumbled into a particularly high-risk group, men who have sex with men, which were a hidden population in Kenya some 10 years ago, but are not anymore and have come forward partly based on our research. One of the outcomes of that research are two new lines, and one line is the importance of community engagement. Men who have sex with men is a very stigmatized group. Various community stakeholders feel that this group should not be allowed to come to the fore. And the other more medical interesting aspect is that we learn so much from the acute HIV infections that they have when they acquire HIV, unfortunately.
So, given the difficulties of perhaps working with this specific group, why is it still so important to work with this specific population to control HIV in this population?
We and others now have documented that there's so much unknown. They have been lacking behind in receiving HIV prevention information. Programs have been targeted to mostly pregnant women and the general public, and key populations, as they are referred to, including female sex workers, drug users, truck drivers, but men who have sex with men is specific, lack information to protect themselves. They have a high incidence of getting HIV and to transmit HIV. So information provision, HIV preventive measures, that education, linking people who test positive to care, training healthcare workers, is an enormously important program that has emerged since we started working in Kenya.
So it sounds like your research work also has kind of a broader impact as well. So can you tell us a little bit perhaps about how your work has helped change public health policy in HIV-affected countries?
Yeah, we have been fortunate to be at the beginning of the policy change and initially quite nervously about what we were documenting. But it turned out that there was a renaissance in Africa of recognizing this group. When we started working with MSM in 2005, shortly thereafter, various countries have documented similarly high prevalences, and studies are now beginning to document the incidences that we already documented in 2007 and 2008. The wider public health impact is that it impacts society, if you like. You recognizing the vulnerabilities in people in stigmatized populations who have not been engaged and benefited from a substantial HIV prevention program in Kenya, impacts training, impacts care, impacts counseling, and all these things are beginning to sort of taken up by the Ministry of Health, which in Kenya is quite successful in putting these key population now at the center of the epidemic.
That's great. Stepping back a little bit, perhaps, what are the most important lines of research that have emerged in the last 5 or 10 years?
From the research with MSM, we learned that when MSM acquire HIV, they seek healthcare for symptoms. That's quite well known in the West, but surprisingly not well documented in Africa, where an estimated 100,000 populations get HIV each year. So healthcare seeking behavior right at the time when you acquire HIV is an unknown area. We learned that MSM went to pharmacies, they went to small private facilities and said symptoms like fever, joint pain, fatigue, and we're quite frequently treated for malaria. So our new research line is in how can we detect acute HIV infection, not only in MSM, but also in the wider population, as it is clear that people seek healthcare when they acquire HIV, but it is difficult to diagnose.
Why is it particularly important to detect acute HIV?
People are so infectious. Right at the time you acquire HIV, your viral load shoots up. Unfortunately, your antibodies at that moment are not yet develop, so you can't detect them in rapid tests. But if you wouldn't learn your status, which is the majority of the instances that is the case, and you continue your risk behavior that you then may have at that time, you will infect 3-4 other persons in the next 6 months. So these are estimates, but it sort of indicates how an epidemic can spread.
Why is this line of research important? Why should we put money into it?
The budget in Kenya, $500 million a year, very focused on treatment of people with prevalent HIV. For every 2 new cases that will be started on ART, 3 new cases actually acquire HIV. And as HIV spreads so quickly right after the moment you acquired HIV, we need to develop algorithms that people can be evaluated with more costly lab assays to detect acute HIV infection early.
I see. How does your work fit into translational medicine within the department?
So most of my work is actually quite operational, and I would think I'm already on the translational side. Because many questions arise. When you identify patients with acute HIV infection, are such patients willing to be linked to care, start their ARTs, retain into care, suppress their viral load? So my public health questions are on the operational side. There is a basic science component to it that actually links us quite nicely to the department, but I'm on the translational side already.
Great. Thank you so much, Eduard. That was really interesting.